After the bariatric surgery, which leads to a significant weight loss, many epigenetic changes were reversed. So this also tells that there is a passing on of the metabolic situation to the offspring at the point of conception. So taking these three into account, we will have to decide that there need not be a purely genetic transmission. So there has to be some other mechanism by which the risks of the metabolic abnormality in the parent or grandparent will be transferred to the a grandson or a son. So what could be the mechanism? The mechanism is basically germline epigenetic modification and the in utero environment. In utero environment, we all know that when a fetus is subjected to a harsh environmental metabolic situation, the fetal stands to have the metabolic abnormality when it grows up. But epigenetics is one of the most important topics now, and of course this is going to be the future of medicine, wherein most of the ailments, especially the metabolic abnormalities, can be treated even before conception. So what is epigenetics? Epigenetics is something that happens on the gene during the situation, an abnormal situation or a normal situation. So in these conditions, the gene is not altered, but only the expression of the gene is altered. There is a temporary alteration in the gene that is passed on to the offspring. And most importantly, if it happens during the conception period or just pre-conception period, so there is a big problem. So how does it happen? There are three mechanisms. The DNA methylation. So DNA methylation is methylation of the DNA segments. So methylation of any DNA segment can cause or can silence that particular DNA transcription, or it can express more. So it depends on what part of the DNA is methylated, and thereby these things can alter the expression of the gene in both the mother and the fetus. Next is the histone modification. Histone, because we can understand what happens in the mother, can be passed on to fetus. But what happens to the father? How can it pass on to the fetus? So this epigenetics is one of the major explanations. Epigenetics to the gametes or the sperm to the father can do this. So histone, we all know that histone is a protein over which the DNA is tightly coiled. In each cell, only that particular part of DNA that has to be expressed will be little loose, and it will be open for the transcription. But this histone modification, due to the various transcription factors, can cause an abnormal gene in an abnormal place to express. So this is even used nowadays in the treatment. And then comes the small RNA. We all know that small RNA have been already used in treatment. We all know that inclisiran is one of the molecules that targets the PCSK9 receptors, and they are used for treating statin resistant dyslipidemia. So what is the small RNA? Small RNA molecules, they don't code for proteins, and these proteins play a role in regulating the gene expression. So research suggests that the parent's metabolic state can alter the non-coding RNA content of the sperm and the eggs, transmitting the information to the embryo. So now we do understand that even a temporary, there is one more.
1 minute more.
1 minute.
1 minute more.
So the implications of such transmissions is like family history. In future, taking the family history shouldn't stop with just ancestral father or grandfather. It has to take into account the entire ancestral environment too. So just having diabetes in father or grandfather is not enough. A non-diabetic grandfather exposed to a famine or over eating could be a risk here. So we will have to be very clear in taking that history also. And of course, we have been very diligent in treating the GDM or whatever it is, metabolic abnormality in the mother. Now we will have to prepone it while planning the pregnancy itself. So these epigenetic, that's it sir, finished sir. So these epigenetic interventions can mitigate the disease. The future is epigenetic modification, sRNA biomarker discovery, and of course ethical framing. So what is the take home message? So if you are ill, don't feel guilty, blame your grandpa. And of course, if you don't want your offsprings or your grandsons to be ill, try to get your children married before they develop any metabolic abnormalities. So get them married early.
Thank you, Dr. Vengo sir.
Thank you
for your nice presentation and very new informations and insight into this very good but different and unusual topic. Next I call upon Dr. Joseph Panneerselvam sir, diabetologist from Trichy, and he is going to talk on metabolic surgeries. Sir, your time is 13 minutes plus 2.
Thank you. A very good morning, one and all. At the outset, I would like to thank the organizing team of TRAC 2025 and Balamurugan sir for giving me the opportunity. So my topic is metabolic surgery. As we all know, so the obesity is and related type 2 diabetes and other disorders, they are increasing in a pandemic proportion. So we have medical management of obesity and these disorders, but they are not adequate to address the complications. So now the focus is shifted to metabolic surgery. Actually, it's not a new concept. So these surgeries have been started in 1960s itself. So we are going to discuss. So I'm going to discuss about this metabolic surgery. What's the role of metabolic surgery in treating obesity and related metabolic conditions? This is all the agenda. So the obesity and type 2 DM, they go in hand in hand. So metabolic surgery is an important option to achieve substantial and durable weight loss, because the medical management may not be able to bring about desired weight loss. So the substantial and durable weight loss is possible with the metabolic surgery. So the mechanism seems to extend beyond weight loss, and reduction in CV risk factors translates to better outcome if we go for metabolic surgery. And what is metabolic surgery? So these are the range of procedures that modify the stomach or small intestine to either restrict food intake or reduce nutrient absorption, or both. These are the very important mechanisms. Either they have to restrict the procedure, they have to restrict the food intake or reduce the nutrient absorption from the duodenum, or some of the procedures they provide both. Lead to significant weight loss and improvement in metabolic conditions like type 2 DM, hypertension, obesity, and sleep apnea and other related disorders. So the pathophysiology of obesity is very complex. So the many factors they contribute to the development of obesity, like environment, epigenetic, genetic, physiologic, socio-cultural, and so many factors are responsible for the development of obesity. So the obesity is graded by using body mass index. So the normal BMI is 18.5 to 25, and overweight 25 to 30, and class 1 30 to 34, 34.9, class 2 obesity is 35 to 40. Any BMI more than 40 is classified as morbid obesity or class 3 obesity. These metabolic surgeries, they play a very important role in the last two categories. So either morbid obesity or patients with class 2 obesity with comorbid conditions. So these are all the obesity associated conditions. So the type 2 DM, hypertension, dyslipidemia, obstructive sleep apnea, arthritis, GERD, non-alcoholic fatty liver disease, PCOS, and clinical depression and functional impairment. These are all the concepts or disease conditions associated with the obesity. And it can produce variety of complications from head to foot. So all the systems are involved. So with the obesity, so we have to find ways to control this obesity, to prevent these complications. And we have medical management, so very